I'm getting ready for a very long trip, and I hope I can survive it and what I have to do to prep for this trip. Hey everybody, how are you? My name's Sam. And this video, that's what I just want to talk about is I have a long trip coming right up next week. I have not done a video for quite a while because in the recent few months, I just really have not been in the best shape. Just been having all kinds of issues and problems. A year ago, I had the left hip revision, and I'm still working on trying to make that hip stronger. And then a few months ago, my right hip starts hurting. So I'm concerned that, my right hip is already giving out a little sooner than I expected. Now, I did mention in many of my videos, I had both of the hips replaced in 1995 and 1996. I just had the left hip revision last year, and then the right hip needs to go too. Uh, so it kind of made me a bit frustrated, and I also brought up a lot of my anxieties and a bit of depression because my left hip, it starts hurting. What the worst part is, it started hurting after I booked the ticket. I don't know why I couldn't. It didn't hurt before I booked the ticket, but I heard it right after. And my concern is that I I am planning on having the surgery sometimes in either this year or next year. The reason being, I was supposed to be do that sooner, and then I had the right arm surgery, as you probably many of you seen my videos. Um, I got a damage on the right surgery in August 2024. The nerve damage to my arm. I can't use my arm to hold my body up, so I have to postpone my elective right hip revision. I was hoping I can get a couple more years out of it, but when it starts hurting, I was concerned that it was actually giving out sooner than. But luckily enough, I did go to my surgeons, and they took X-rays. They said it's more muscular than things happening in the hip, the actual joint. So I'm a little bit relieved, but I am still concerned because it still hurts. The more I walk, the more pain it induces. I will be in Asia, mostly in China and Hong Kong. That requires a lot of walking. Rely on public transportation with the subways, and it's going to be a lot of walking. Basically, all these walking kind of makes me a little concerned that I don't know if my hip can withhold the amount of walking that I'm going to be doing over there. And I guess I just have to dial back if I really need to, kind of rest when I really need to. So yeah, preparing for this trip is just a whole lot of concern. Seems like one after another, one issue after another. That's why I'm actually a bit frustrated as well. And this also have a lot to do with my anxiety and depression, because whenever something hurts, whenever things happening, I tend to jump ahead in conclusion that something is wrong, like my hip. I was thinking that my joint is giving out, and I might have issues when I get there. And then the other issue is with my IBS and acid reflux. It really kind of acted up recently. I have really bad esophageal pain coming down here, and I made my anxiety a whole lot worse. I'm getting a huge brain fog. Um, I've been having a bunch of cognitive behavior that I just can't see things clearly. I cannot focus. It really made my anxiety like double on. It made my anxiety on overtime. So for the last few weeks, I basically just been scrambling to see doctors. I saw a couple of surgeons. I saw a psychiatrist, and they put me on some medications. That's not really helping. Seems to make things a little bit worse. I also saw my rheumatologist. Also got some got some non-steroid anti-inflammatory drugs, just in case I'm having some inflammation on the hip, as well as my hand is still trying to recover from all the nerve damage on the shoulder surgery. So there was just a lot of things going on. This trip kind of made my pressure a little bit worse, because I'm a little concerned that I don't know if I can really make it through. But since I already booked the tickets, and it's really non-refundable, quite expensive. There's 3 tickets. I'm going, with my mom and my sister. So if I cancel, they will be canceling too. So that would be a few $1,000s gone the drain. So I'm biting the bullet and hopefully get through this trip. But I'm pretty sure right after I return, I need to set up a schedule to get my right hip revision done sooner than later. But in the meantime, just to prepare for this particular trip, I had to make some purchases and do some research to see what I needed, prep all of my medication. And it took me a long time to find a case where I can actually take my biologics with me. Now I am on Cimzia. Cimzia does not have a quick injectable pen. It's much easier to pack the pen rather than the syringe. The Cimzia comes in a syringe. So unfortunately, it took me a while to find a cooler container slash small enough, compact enough to hold, and it's large enough to hold the syringe. And the more importantly, I'm looking into something that can last for the duration, to keep it cold, to last for the duration of my trip. Because going over to Asia, flying into Hong Kong, it's going to be a 15-hour flight. Not to mention the time that I'm going to need to get to the airport, check in, and as well as getting out of the airport to the hotel. So that's going to be at least a 20 somewhat hour of length. So I need something to kind of keep it cold, keep it at least cool, for the duration. I know I can have the biologics out for about 7 days and it'll still be fine. I'm not going to be using all of the biologics all at one time. So I need to have at least 2 of the syringe to keep it cold. 4 weeks away until my next injection. But I did find one that actually works large enough to be able to put my syringe in there. I just have to figure out how I can extend the cooling time. I also took a few vaccine shots just to prepare. Hopefully that I'm not going to get sick on the other side. I had the shingle. I had the flu shot. That's actually back in last September. I also had the pneumonia shot just for preparation. I did not get the COVID, but I do have a antiviral medication. Oh, I almost forgot about the disclaimer. Everything I talked about in this video are basically things, medication that I'll be taking with me. These are medication that I've been on, and the preparation is basically all mine. All the doctor visits and everything else, getting all prepared for a long trip. These are all medical conditions that I'm dealing with at the moment. If you have any concerns in traveling or anything that you need to take for your vacation or time off, talk to your doctor, see whatever you need. Got to make sure that you have all these medications with you. So make sure you talk to your doctor and gather everything that you need, get all the refills, and prepare for yourself. This is the container I've been talking about. I've been looking all over the place for something that's big enough. It's like this. It's actually a vacuum. This will hold the keep the cool to keep the cooling gel inside much longer than the other type of carrying case. So this is what it is. This diameter is what I really need because this is my syringe. It's not it's not a pin. If it's a pin, it's just one big tube that you can easily slide in. But the width of this needed to be big enough to kind of go in here. And I've been looking all over the place, and I finally found one. It's pretty big. It's like a water bottle, but this should work just fine. Yeah, the diameter is 2.6 inches wide. I have this old one before. This will work for the syringe, but the problem with this thing is it does not keep it cool for too long. The gel in here will only last for maybe about 4 hours. And like I said, I'm heading over to Hong Kong. That would be a 20 something hour back and forth. Sorry, not back and forth, but in and out. So this is what it's like inside. It's a double vacuum, just like the water bottle. Hopefully, it can last for the duration of the trip. On on top of that, the most important thing about going over to a trip is look at that. This is only half of it. This is really what I needed. These medications, what I needed. I have my blood pressure medication. I do have high blood pressure. I actually have three different types. Um, one is a regular high blood pressure, and then the other one is actually a diuretic, just in case my blood pressure actually shoots up pretty high. And then I have another one just in case my blood pressure goes extremely high. Actually, I have four. I do have one that's also for palpitation. And then I have my acid reflux medication in here, um, with the IBS medication, as well as I have uveitis, so I have anti-inflammatory eye drops. I have allergy eye drops. And I just got another prescription from my rheumatologist for the non-steroid anti-inflammatory drug, just in case that I have a lot of pain. So I need to take that. I have dry eyes, as you all know. Many people who have autoimmune disease have dry eye as well, so I need to keep that moist. I also have a anti-anxiety medication, and I also have a set of antibiotics just in case, because you never know when you're going over to another country. Sometimes it's easy to kind of catch, some thing that's bacterial or something. So I have a set of antibiotics that take it with me just in case. Now these are only the medications that I pretty much must have, and I take it on a daily. Some of them I take on a daily basis. Most of the stuff I don't. Blood pressure I do, but like acid reflux on as needed. But still, these are the more important medications I'm taking. Now this other set of medications, or so to speak, is not just all medication. I am taking a Ploxavax for the COVID. Also, I'm taking some fiber as well. These are all supplements and probiotics in case my colon kind of acts up. These are on the side. These it does not must. It's not a must have. I also have some Tums with me. So these are not very necessary, but it's good to have as a preparation. I will be gone for a month and a half, so I will be gone for quite a bit. It's going to be a long time, so that's why um, certain medications and certain supplements you just cannot get overseas. It's much better to pack some of them here myself. And here's a little more that I have to take. um, antibiotic cream and fungal cream, just in case if there's any fungus in the feet or whatever I need, and some other. I also have a Voltaren gel, the pain medication gel that was prescribed to me by my doctor. It really, actually, the Voltaren gel works really good, great for minor pains. I have my hand is still not good. I use it a lot on these little joints here. It works quite well. So I have all that prepare. The main thing is to kind of get your doctor to make sure all the refills are in, getting the pharmacy to get a refiller for you, and get it all prepared to go. It is a bit of a hassle because I have to, I have to make sure I get all this. Look at that. It's quite a bit actually. But on the safe side, I just need to have these with me just in case when I needed it. It's not a necessity to have all of it, but just in case, I needed it. Oh, I also carry I always carry a chewable aspirin, just in case for, blood thinner purpose, heart and all that stuff. You never know when you're traveling. Got to have some of these stuff ready to go. So those are all my preparations and getting ready to go for my long trip. Hopefully, I'm not missing anything, and I am very excited. But I am also quite concerned that hopefully, my hip is not going to give me too much problem. I am concerned that I might overuse it and something would happen. That's why it's kind of driving my anxiety a little bit high. But still, I am very excited. Going on a trip is always fun. Able to get out there and enjoy whatever the life I still have remaining is actually good. Not like I'm going to die, but pretty much, having ankylosing spondylitis with a lot of pain. We don't get a chance to do a lot of stuff or do enjoy many of the stuff that normal people have. But whenever I have an opportunity, I will be taking it and trying to make the best out of it. Should you, if you guys have able to do whatever you need to do, go wherever you need to go, or go wherever having fun. Enjoy it. Take the time to enjoy it, and worry about the pain and things like that another day. But yeah, enjoy life. Anyway, that's all for my video. Thank you for watching. If you like my video, please give me a like. And I will definitely update you guys on the trip, see how I'm doing, see where I'm going, if it's fun or not. Am I able to survive or not? I'll keep an update. I just have not been doing a video because I just been having one issue after another that kind of make me a bit depressed and frustrated. But I want to get back into this. I still have not finished one of the other videos that I should be doing, but I am going to do that after I come back. I'll go enjoy my trip first. Hopefully, everybody else is out there having some fun, enjoying yourself as well. And I know the pain can be quite a bit at times, but at least hopefully trying to make the best of it. Take good care of yourself, and then I'll see you on the next one. Please subscribe. Thank you. Bye bye. Take care.